Hello and welcome to the Niche Guarda YouTube podcast show. Once again, powered and produced and in collaboration with citiesabc.com and businessabc.net. We're very excited to continue profiling global leaders and personalities that actually can bring more positivity and more direction towards a world that is very complex, full of innovation, but full of complexity and perplexity and disruption. And what we're facing right now in all the areas, especially with the advent of disruptive technologies and AI, is in one end, probably the most advanced innovation ever in history of humanity, but as well the most disruptive sense of displacement and sense of almost dystopia that ever we faced collectively. So I want to continue bringing, and I've been always highlighting the personalities that I like. And today I'm pleased to bring again for the second time a personality that I think for the ones that didn't saw the first interview, please go there. But it's someone that has a wealth of knowledge and experience that touch everyone because everyone has a health and has a body and needs to manage this body. So I welcome again to our series for the second take Pradeep Goel. And Pradeep, for the ones that didn't pick the first one, shortly is global leader in healthcare that is behind the global multinational that is Solve.Care. And Pradeep is a person out of the box for his humility, detailed work, but as well for his hard work, pushing forward boundaries of technology, healthcare, and as well businesses around the world and institutions and governments. He's an expert in blockchain, finance, technology, and with 3 decades of experience in these areas, especially in combining technology, blockchain, finance, and healthcare, he's been actually bringing a lot of solutions that I was very excited, and that's why we have a Take Two to highlight. So a lot of these roles from CEO to COO, CIO, and CTO have been touching from insurance to healthcare and technology. And of course, with the Solve.Care, he built a global healthcare tech blockchain company that builds and interacts digital health networks together in a platform that combines a wallet and as well a huge advanced platform. In terms of the work that Solve.Care has been working and being highlighted is the global telehealth and teleconsultancy solutions in over 20 countries and the global telehealth exchange. And this is something of the distinguished service that we're going to be highlighting in this Take Two. And before establishing Solve.Care, Pradeep co-founded 4 healthcare IT companies, including EngagePoint, Dakota Imaging, later acquired by WebMD, which rank among the top companies in Deloitte's Technology Fast 500 and Inc. 500, 5,000 fast-growing companies listed. So Pradeep has been involved with the healthcare initiatives of the Bush and Obama administrations to design and build several public program solutions under the Health Savings Act and the Affordable Care Act. He has been instrumental in designing and building solutions for public programs such as Medicaid, Children's Health Insurance Program, Medicare, and a lot of different organizations in the US where he's based, but as well all over the world where the company has a strong footprint. And about Solve.Care, we're going to be touching together, but it's a full stack tech blockchain company that enable healthcare platform that decentralizes health networks and combines together solutions. Welcome again, Pradeep.
Dennis, it's a pleasure to be back, and I'm honored to be here again. So thank you very much for having me.
No, pleasure is all mine, and I want to learn and see the challenge that we have when it comes to health and technology, because I think at least if we can align this, we can actually bring some more positivity and different parts. So today I want, and for people listening to us, I always want to make sure that this series are educative for everyone listening to us as they are for me. I learned from Pradeep, and I hope that you can learn from him, and we can actually all together engage here. So when you look at the challenge facing the healthcare industry, that's a big thing, okay? Because we are in one end having more technology than ever, and the average lifetime and lifespan of all of us, thanks God, is bigger than ever. For instance, if you are in the beginning of the 20th century, the average lifespan of humanity was 20 years old. Now we are in 70 somethings, in some cases going to 100, and there are already some experts talking about potential extending life to 150 to 200 years. So, but before you go there, let's go to Solve.Care. So Solve.Care. So one of the things I would like to touch today is, okay, when we talk about blockchain, and we touched this in the first interview, but today I want to touch a bit more. There's a lot of things that, of course, for a person that is not comfortable with blockchain gets very lost. I would say probably 90% of people when they speak about blockchain or think about blockchain, it comes something about crypto speculation and a lot of negative stuff. So let's focus on the positive things. And when we talk about self-care, and I think for people listening to us, you'll see the infographics here. There's a lot of things that you guys built. So in one end, there's a full stack platform. In the other end, there's a care.wallet. That is a gateway to a diverse range of care networks where you have total control over what network service you want to use. That varies from diabetes to mental health to transportation to a lot of different providers and systems. So let's look at a bit of how do you build this kind of the full stack platform and the care wallet, and how they work combined, and a bit of the history, and then about the technology and how it works. And of course, we are quite technical, you and me, but I would like to make it simple for our audience as well.
Yeah. Healthcare, at its very fundamental, is a network problem. And what I mean by that is healthcare is never a solo sport. I don't get to take care of my health by myself. So there's always going to be a team, and that team needs to collaborate. And that collaboration is determined based on my need and regulation, payment, and many other factors. But in the end, it's a coordination and collaboration problem, which requires people to effectively network with each other. Now, there are a lot of challenges with achieving an effective healthcare network in the general sense, because you have regulatory issues, data issues, skill issues, access issues. So of course you can have a challenge when you need to collaborate so many people effectively around care of a patient. You need a very effective networking tool. And those tools don't really exist. I mean, you have a lot of efforts done to make this network function better. Much technology has been devoted to making these networks work better, but there is no real solution in making this network fair and efficient. So far what we have, pre-blockchain, pre-Web3 world, are these networks are built by organizations or institutions to optimize their business processes, and you are supposed to fit that network. And if you don't, well, you're going to suffer accordingly. So whether you're a patient or a doctor or a pharmacist or a lab or a family member or a caseworker, there are so many people who need to effectively collaborate, but typically they collaborate around an organization's defined parameter. The organization sets the rules of the network and we all follow it, or else we don't get care. So that's a pretty imbalanced way of doing things, because typically those networks aren't defined around a patient or patient needs. They're defined around business processes and optimizing revenue and minimizing cost and things like this, which are fine, but it's very hard to trust these networks because these networks are built by somebody for their own business interest. So it leads to a lot of waste, inefficiency, and most importantly, low trust between parties, because you're forced to live by somebody else's rules. And when you are vulnerable and you are sick, you accept those rules, but you're not happy about them. And they don't always serve you well. So now, where does SolveCare come in? You mentioned a lot of my healthcare career. The way I see it, my career has been to experience different networks in healthcare. Public health networks like Medicare. What is Medicare? It's a public health network. It's a multi-sided network where you have patients, you have doctors, you have nurses, you have hospitals, you have labs, you have pharmacies, and they're supposed to collaborate with each other per the rules defined by Medicare, which is the government. You have Medicaid networks, similar in nature, with different rules. Then you have insurance networks defined by people like me in my old role as an insurance CIO. I set the rules of insurance network, and you either accept or you don't get insured. Then you have, now IDNs, big IDNs like Mayo, Hopkins, Kaiser, Common Spirit, and they are delivery networks, and they set their own rules on how you're going to get cared for. And by and large, we know that those networks will write rules to their own benefit. So all these networks exist. They're all controlled by an entity whose interests are not always aligned with yours as a patient, as a human, as a citizen. Having experienced all these networks and the way they work differently, but more similar than different, I realized that we need a different platform on which better networks can be built for healthcare, where there is not one party defining the rules of the network and everybody else has to accept or else, and the network can be more transparent, equitable, auditable, and it allows everybody to maintain their rights and dignity and not have to trade off get care or keep your independence. So in that sense, what we are trying to bring fairness to healthcare. And we're trying to bring options to healthcare where both consumer and the institution, all the parties of a network, can agree to collaborate with different set of rules, with a different set of agreements. And those agreements aren't going to be one-sided. They're not going to be asymmetric. They're going to be symmetric, and that both sides' interests are equally protected. And to achieve that, you begin with basic premise. Can every participant in the network can they be anonymous? Do they have to reveal their identity? First place you begin is whether identity must be shared, or can that be shared only on a need-be basis? Can we control data the same way? Can data be kept in the hands of the participants, not always given to the network to control and manage? Can payments happen peer-to-peer versus having it through a centralized gateway? So when you start to take this network model and you start applying to that Web3 principles of user-owned web, user-controlled identity, user-managed data, and transparent business logic, and compliance with rules that don't favor one party over the other, when you do that, you end up with SolveCare. Because what SolveCare has done successfully, we started with this bold mission that the current IT infrastructure supports these very asymmetric, unfair, prejudicial networks, but that's what currently exists. So IT infrastructure supports what exists, but you need a new IT infrastructure which allows for more equitable networks to exist, but that infrastructure cannot be built on Web 2, it has to be built on Web 3. And here we are, 7 years later. We built exactly the platform where fair, equitable, transparent, symmetric, balanced networks can be achieved, and where roles and responsibilities of each participant can be published and protected, and they don't rely upon the goodwill of a central authority honoring their contract. But that never works. And the last thing that I will say, to bind it all together, okay, great, you can build this fantastic IT infrastructure, sounds pretty compelling. I feel like I'm going to benefit from using it, but how do I use it? So Care Wallet is our equivalent of a web browser. So we basically built a new World Wide Web for healthcare. We built a new paradigm, a new web paradigm for healthcare. So that is equivalent to basically the internet. And then the browser is a Care Wallet. So in that sense, no matter who's using our platform to build a new healthcare network of any nature, for whatever disease condition, for whatever group of patients, under whatever set of rules, everybody in the world can access these networks through the same browser called Care Wallet. So the wallet is the equivalent of the browser if you think of the health networks as the equivalent of a more fair web. So that's who we are.
Fantastic. And let's go right now a bit on the way it works and how it works, the blockchain part. We touched this in the last one, but if we can go a bit more in detail, especially like I mentioned before. So in one end, you have, like you mentioned, there's all the different organizations that are involved in the healthcare process.
Yes.
But if I'm a user, let's make it simple, okay? If I'm a user, like you said, I can get a wallet, and then in the wallet, I can find the doctor, I can find an appointment, I can even get information about different things. But on the back end, there's a full stack blockchain technology that enables the platform and decentralize the health network. So let's start by explaining exactly how this blockchain technology system enable an healthcare, and I'll go detail that, an healthcare platform that decentralizes health networks and combines this together in a secure way.
Yeah, and there's a lot to take in. So let's break it down. So look, when you are using the browser, Safari or Chrome or Firefox or Microsoft Internet Explorer or whatever, you are just going to an address and you're browsing a website, dennisgarda.com, and I'm going to find content that I want to see. So all you need to know is where to go. And then the whole backend website is presented to you. You don't really care whether the website is built on PHP or Java or Ruby on Rails or Python. So many technologies on which you can build a website, but all you want to do is to go to an address and browse the site. So I think most humanity today knows that browser gets me to an address. I put in the address, I go see the content. So to apply that same paradigm to healthcare, we said you should be able to choose the site you want to browse or choose the network you want to join based on your healthcare needs. So whether if I have risk to diabetes, then maybe I want to search for networks that deal with diabetes and join those networks. Kind of like joining an Instagram feed or a LinkedIn, group to say, I want to focus on this content. But instead of just reading some website page, what you get in the wallet are actually cards, deck of cards, and these cards are applications. They're not some static pages, right? Think of it as a much more advanced internet where, and as we know, you can go to websites and do a lot of things. You can go to schwab.com and trade stocks. So similarly, you can go into the Right Care network on the Care Wallet and buy medicine or find a specialist or get a second opinion on your MRI or compare the risks of taking this drug. So those are different networks that serve different purposes, and you just join the right network and you will interact with the network using cards. The network will publish the cards that let you do something. So and the card can do anything. So card is the app which appears when you join the network, and it appears in your wallet. And using that card, you can interact with other parties. You could request for an appointment or get an appointment or refer a patient or get a referral from a doctor. So as long as I'm in the same network as the patient, the specialist, then as a physician, I can issue a referral and notify the referred specialist that, look, I'm sending, Dennis to you for this reason. Please do a proper consult here. Let me know what you find. So that kind of care coordination becomes a lot easier, but you could do some of that with the current tech, the Web2 tech. But where this becomes much more interesting is that all three of us, ABC, me, the doctor, let's say you, the patient, and somebody else is a specialist, have very unique rights. We control our data sets. Every transaction we do with each other gets written to the chain in a way that, without exposing my identity or the content of the transaction, we have a record that A referred B to C, C sent an appointment to B, B went and did the appointment, and then C notified A what happened. That event ledger is on the chain, but you cannot tell who A is, who B is, who C is, and what they really talked about. That's data that's not on the chain. That's anchored to the chain. So this way, the blockchain enforces the right behavior and tracks the right behavior, but doesn't expose the identity of the data of the participants of the network. So this is one very clear use case of blockchain. And I will say this again, that one of the common, I've said this many times, just a sidebar, there are many blockchains that deal with data, with patient data management platform, data aggregation platform, data collection. It's all fine. That's a good use case where it makes sense. But in my mind, those chains are going to be by definition very narrow in their scope because they have to live inside the compliance framework of whichever country they're running in. And it's really hard to see how you can have a global medical record chain and be compliant with every country's laws. So our view is that SolveCare as a blockchain is never going to be the data management chain. We're going to be the data consumption. We'll consume, our network participants can consume the data on whatever chain they have it, but ourselves, we are focused on facilitating these networks. So we are kind of like a marketplace platform, which enables these very complex, transparent, and governed and compliant networks or marketplaces. You can use them interchangeably to drive better coordination and outcome of healthcare. And we let the data management of patient data in the hands of others, which is in some sense a simpler problem and a more complex problem. So we will work with any data chain out there that is credible and compliant in the region that they operate. But we as a platform are much broader than that. Our vision is to enable more symmetric, equitable healthcare networks. So then coming back to the wallet is how you browse the network, is how you interact with the network. And you do that through these apps called Care Cards, which execute in your wallet, which give you a tremendous amount of privacy and control and security. You don't run these cards on some server in the hands of somebody else. They actually run inside your wallet. So your wallet is your computer at that point in time, right? And if the wallet needs more power than it has on your phone, it has a Web3 virtual computer behind it that you control, that's allocated to you, and you can run. It will execute more complex processing there. You won't know the difference. You will think the wallet is doing everything, but the wallet may call upon the node, as we call it, and do more heavy compute there, but you won't know any difference. You would just say, hey, Dennis sent me this card, and this card, when it interacted with my data, produced this risk profile for me. That's pretty cool. And you can be sure that this card, when it arrived in your wallet and looked at your data in your wallet, does not have any ability to share that information with somebody else. You are totally secure, you're totally private, and your ability to interact safely with others is 100% guaranteed by the architecture. So that's how we use the blockchain. We use it for tracking events. We use it for moving funds between parties, doctor, patient, patient, doctor, doctor, pharmacy, pharmacy, doctor, whatever we are moving between parties. Cards can carry with them data, they can carry with them tokens, they can carry with them consent, they can carry with them identity. So these cards, when they move between wallets, lets you do basically a new kind of a World Wide Web where wallets talking to each other can solve basically any business problem. And so far, we haven't run into any network problem that we cannot solve because the architecture is kind of like, it's a very powerful paradigm for new kind of a compute, which replaces both client server computing and replaces cloud computing. It goes to edge computing. That's what we have basically enabled, is a completely user-controlled compute model that never existed before.
That's an impressive, and I love that you put it very concise and very organized. So I think for people listening to us, feel free to ask questions and engage, but I think it's important to understand this. And I think it's a masterclass in the way as well a lot of these things work. So I want to touch one thing that normally people speak a lot, but very few people can understand. So continuing on the technical part of the blockchain handling, decentralizing healthcare. So part of the strengths of Solve.Care is the platform decentralizes healthcare by tokenizing 5 key aspects of the healthcare system. One is identity. So the traditional issues with healthcare identity is the systems are fragmented, and this is probably one of the biggest challenges for the world economy. The second one is the data. And the data is, of course, everyone is cautious about that in one way or the other, especially when it comes to data in healthcare. There's a lot of case studies how this affects a lot of different things. There's the consent, that of course you have to consent the usage of data. Then there's the transaction, and this part is probably the part that is more sensitive, is that of course, when you put your data in blockchain, you know that it's secure and monitored, but sometimes you don't know how it works and how that parts. And then there's the payments that you can actually use for this. So on these 5 areas of the tokenization, can you explain probably in a simple way how we integrate the 5 areas that are critical for actually that everyone that, well, almost for anything we do, we have these 5 areas, but you are doing in the context of blockchain healthcare.
Yes, and you're absolutely correct in that these are kind of the 5 pillars of building a new computing paradigm. So if we're going to give a user-controlled network capability where I, as a user, join a network and I have absolute control over my data and identity, and just because I joined a network doesn't make me a person at disadvantage, and the network doesn't get to just arbitrarily use my data and monetize it, and I just get to be I just get to watch while they fully take advantage of all the network economics. Those are all the things we don't want to allow. We want to allow equitable networks that every party has equal rights and all participants treat each other with the same set of rights as they want to reserve for themselves. So institutions should not have an unfair advantage over the consumer, in a very simple sense. So let's go to how do we achieve that? So then the network design must permit somebody to own their identity, every network participant, to be able to decide if and when and how much of the identity they want to reveal. So what we did is we created a multi-dimensional identity, which for each dimension there is essentially a tokenized ownership of that identity piece. So think of me as a human being. I have a name, I have an address, I have a telephone number, I have an email, which I'm willing to share. That's I may have a social security number in the US or NHS ID in UK or Aadhaar ID in India. So I have a human ID, my name, my immutable, my defined permanent characteristics. I have variable characteristics like my phone, email address. I'm going to have domain-specific characteristics like my insurance ID, my employee ID, which are going to be relevant for a period of time, and they will only be relevant to a certain part of my life. And then I'm going to have financial identity as to where I bank, which credit card I use, how do you pay me, how do I pay you. I'm going to have also my clinical ID. What kind of disease conditions am I prone to? What disease conditions my family has had, or what I'm likely to develop. I'm also going to have benefit ID. Which programs are eligible for? Am I eligible for Medicare or Medicaid, or can I go to NHS, or am I not a citizen of UK, so I can't go to NHS? So these are different dimensions of human existence that we map to what we call the care profile. And we allow, and care profile is a deck of cards, and each card has a very specific purpose. And that card contains only that specific data. And you can expand this deck of cards with new cards as new identities emerge. So for example, we are introducing a new card into the profile deck regarding, DID and these new ID chains that are coming up. We hear a lot from Polygon about their Polygon ID chain. So they are new ID paradigms. Polygon ID, you don't have a Polygon ID probably, and I certainly don't today, but you might in 3 years or in 3 months. So we can expand the ID deck infinite. So this deck will keep getting more cards into it, but the cards are purpose built. Now, every time you send a card or somebody requests a card from you, that event of that card being shared is on the chain. So we have a permanent record of whether Dennis did share his, financial card. You don't need to re-enter all your financial data. You just share your financial identifier to somebody, and now they have it. Now, this gives both sides protection because they have a tokenized record of that. The card is tokenized and it's in their wallet. They can access it as long as they have permission, and you could revoke the permission, in which case that card will no longer be readable by them. But the transactions they conducted with you will be on the chain, so they are immutable. So neither side can deny them. So if they end up sending payment to the wrong party, well, you have clear proof that you sent them the card with the right information. Or if your card has wrong information and they took a financial loss because your information was wrong, well, they have proof that you sent them the wrong information, right? So every party is accountable. There is no obfuscation of facts afterwards. There's no need to go to court and fight things out because facts are there. They're immutable. They're on the ledger. And every exchange has been tokenized and moved between wallets with an immutable event ledger. So that's one way to look at tokenization of ID, is taking your fixed attributes and making them tokens so they can be tracked without being disclosed. Just because you sent an ID token from your wallet to mine doesn't give Felipe the ability to see what token you sent, other than he knows the type of the token. That Denise sent a token that represents card 3. Card 3 is financial data. That's known in our public domain, repository and all our published information. So, okay, card 3 is always financial data. Denise sent the card 3 to Felipe, so now we know that this happened. But we don't know what is on your card, because that's privacy, that's your data. But it's immutable data, it can be changed. If you change it, it'll issue a new token. So now we know when you change your bank information, or you know yourself, rather. So this allows for this non-negotiable event ledger with the tokenized exchange of very critical information that then underpins all disputes and resolution and quality control and payments and everything. Because in every system, be it healthcare or be it finance, you have to verify what A did against what B says they did. And is there a proof of A did what B says they did? And did they both act according to the rules of the network? That's 99.99% of IT in the world. We are making it a lot easier to do what is very, very hard to do today and very expensive to do today in the Web2 world, by making all these transactions private but immutable, private but secure and provable. And that's the hard balance, right? How do you keep data private while proving that the right things happened without exposing the data? So that's the value of tokenizing things like identity into this tokenized deck of cards that I explained to you. There's hundreds of other value propositions tied to something like that. But in some ways, you get into trying to explain what computers can do. We are basically building a new computing paradigm. So you can do almost everything computers can do, but you can do them better. But in the case of healthcare, where we are really trying to get to is better access, lower friction in healthcare, easier access to care, less cost of administration, fairness in how care is given, eliminating the bias that is resident in every network, based on any number of factors. And most importantly, all sides should know what their roles and responsibilities are. And if anybody steps out of bound of the network rules, everybody else knows too. So it really brings us to this equitable model where nobody can hide. Everybody does what they're supposed to do. And if they don't, the ledger will tell you that they didn't do it, right? So then imagine a healthcare system working like that, where you don't get prescribed duplicate tests. Your tests don't go missing. You don't get prescribed the wrong medication, which contradicts with the medication you already are taking, leading to maybe a fatal heart attack. You don't get less care than others based on gender or ethnicity. You don't wonder, hey, are they really giving me the best treatment or are they giving me the cheapest treatment? Because you will have a protocol that says this is the right treatment. And you can easily, your chain will compare your treatment patterns with the best practices. So all these questions we have in healthcare about cost, access, fairness, bias, efficiency, efficacy, am I getting the right treatment? Am I taking the right drug? Am I paying the right price? All of that can be eliminated because a network enforces fairness.
So that's a fantastic explanation. And I think that's the biggest challenge when it comes to everything happening as we speak in the healthcare industry, and the complexity as well, because it's a very complex ecosystem. So let's right now we went through the tech part, and I think you made a masterclass explaining this in a very synthetic and very concise way. So let's right now look at, and you touch a lot of different things. There's the wallet, there's the cards, there's the vault, there's a lot of things that solve a lot of problems. But the challenge of adoption, and I would take something like this bigger, and I think one of the things that I like about what you guys have is that you have, for instance, a lot of solutions within the network. Like you said, in the web, you can find the diabetes care network, non-emergency medical transportation, provider rewards, and different things. So one of the challenge is, I was telling this offline to you, that the challenge that I face, even I'm in the UK, which is a very wealthy country. If I go to my GP or my NHS service, normally the doctor one, even their computer in the room don't speak with the doctor too. So
Yes.
what you're doing is super advanced, and then we go to a major economy and we have these problems. And I know that this is not just here, it's all over the world. It's a problem that a
Yes.
lot of people complain. So I think picking from what you have and still on the self-care, you've been in different areas of the healthcare industry in both roles. And of course, in Solve.care, you've been in a very high profile position and a company that is fast growing. What do you think can actually solve? Because in the end of the day, in theory, it's quite easy to solve a lot of the problems of the healthcare, because you actually just touch, if you just apply this to the healthcare industry, you solve probably 99% of the problems. But you know that the theory is one thing, the practice is another. So
Yes.
from your experience with Solve.care, what would be the thing special do you want to share with our audience? Some case studies that you achieved and breakthroughs, and you mentioned that you worked with Bush and Obama administration. So there's nothing bigger than that. So I'm sure you went through all the challenges and opportunities as well that are in that. But it's a big minefield industry, especially in Europe. There's a bit more of healthcare friendly systems. In the US, is more complicated, from what I understood. But if you go then to the rest of the world, yeah, you have private, public, and it becomes a minefield of actually challenges unless you have money. So a bit of, from your experience in industry, what would be the takers that you would like to share with our audience?
You're absolutely right. It's a complex ecosystem and it will take time. And we will always be pursuing a better world. I don't think we will ever look back and say, we have the perfect healthcare in the world. That's a goal to pursue forever, but never truly achieved in an absolute sense. So we can understand this is going to be a multi-generation, pursuit. And that's totally fine because the world evolves and we want to continue to evolve and be ready for that evolution facilitated. Now, when it comes to how do we actually get utility from what we have built, which is your question, there are really two fundamental ways. And there are a few other adjacent ways, but I'll talk about the core. First way to use the platform is to take an existing network, be it Medicare or insurance or pharmacy or provider network or whatever. And there are many different kinds of networks in healthcare, and they vary by country, but every country has some form of healthcare network to solve the population's needs. That's a given, because I don't know of any country where there's one doctor per patient and they just serve each other. And that doctor is dedicated to the patient and the patient is dedicated to the doctor, and that's it. In that scenario, and that doctor is also the pharmacist and the lab technician, and then you don't have a network problem. But there is no such scenario like that. So every country has health network. They just call different things. But if you really strip away the language differences, there is a health network, multiple health networks in every geography in the world. So what we are doing is working with people who run the current networks and show them that they can run a better network. And the only reason they want to run a better network is because it's more efficient and more effective, which can also mean to more revenue. Because most networks today are built around revenue. We can kid ourselves and say that revenue and cost doesn't play a role in healthcare. It absolutely does. Even the national networks like NHS, they're going to do utilization management. In other words, saying, doing this surgery on a 93-year-old patient, is there enough ROI? And then they will make a decision that, the chances of this person living a healthy life post this surgery is low. The procedure is too expensive. No, we're not going to do this. That decision gets made by the network. You may not know it. It absolutely does. So every network today exists around cost and revenue equation. And yes, there is absolutely the third dimension of quality of care, fairness of care, but there is an overriding economic concern that drives most of the network behavior. So what we do is we go into any network we're talking to at that point in time, we will say, look, you don't have to sacrifice one for the other. Your values are manage cost, deliver highest quality of care at the greatest possible value to the patient. At the same time, you don't have infinite resources, so you need a more efficient network. And you can do that with the care platform. So that's the conversation always. How can we make your network work better? How can we get you to achieve both your stated goals and your hidden goals, parameters and constraints that you're living with? And we can almost always demonstrate that our platform will improve their network execution better. The second thing we can always show them is that a more fair network on care platform, you're going to have more trust from the participants. So patients will trust your network more. Doctors will be more comfortable participating in your network. Pharmacies will be more able to price drugs fairly. So we always demonstrate a more fair, more efficient, more equitable, value to all participants. We are typically not a good fit when you're talking about a completely top-down monopolistic network, which says, I don't care if you live or die. I just want to maximize my revenue. Those are typically drug cartels. We don't work with that. But we work with any regulated network, which is presumably operating on the principles of balancing cost, value, and access to care, which is 99.999% of existing health networks, right? That's one way. And that's what I call institutional evolution. They use our platform, not out of the goodness of their heart, but because we are a better solution than what they have today. And we're not talking about blowing up their network. We're just talking about making it a lot more fair, a lot more efficient, a lot more equitable. The second and equally exciting way, and perhaps more exciting way, is to allow people to build their own networks. So if you're not happy with the network that you have access to through your government or through your employer or through your doctor, well, you can build your own. And that's really the disruptive side of our platform, in that anybody can say, you know what, I'm not happy in my region, in my geography, in my town. We don't have any neurologists. We don't have any, really neurosurgeons, and really everybody's getting treated, in a manner that is inconsistent. So I want to bring some expertise into my town. So let me start a care network on care platform, and I'm going to invest my time and energy to attract and invite neurosurgeons around the world in either economic or in charitable humanitarian model of delivering care to my citizens. So that's just an example, right? You could design any network around a disease condition, around a access to care, around a access to information. Basically, what we are saying to all of you, those who are listening, is that healthcare is scary, but your health needs are pretty clear. You, your family, your friends, your community, those needs are very local and regional. And it is very easy to build a new health network that serves the needs of your universe that you live in without having to be dependent purely upon the networks that are. So we are basically taking it from both left and side. Left side, we're saying we will help the institutional and existing governmental, public health, and the commercial networks to run a lot better, which is clearly proven. And on the other side, we are saying, what about networks that should exist but don't? And you don't need to be an insurance company to launch a new network. You can launch a network on a platform within weeks that can rival that of an insurance company. So those are the two sides we're coming at. And then the third dimension, which I would say is really important, is that we are continuously aggregating partnerships and bringing more service providers like Uber, like Lyft, like AliveCore, like LiveMetric, devices, transportation. We are partnering with a company that does really incredible home diagnostic using selfies, so they can determine your blood pressure by just looking at your 30-second selfie. These kind of services will let people build even more powerful networks. So we continuously add on more and more power to the platform through these partnerships. So when you're designing your network, you have access to all this incredible tech innovation that's happening in the world, and you can leverage that as you design your new network. So that's a third dimension that we focus on, is continuously add power of the partnership to the network, so networks can do a lot more than they could do in the past. That's how we see the evolution. This is a long journey, but we don't have to wait for perfection to make a huge impact. Not every network in the world has to become equitable for most networks to be more useful and usable. So this is, it's an evolution. Not everybody has an iPhone or a smartphone from Android. Some people are still on flip phones, but most people are on smartphones now. So we won't solve we won't address every single network overnight, but the platform is evolving to the point where it becomes easier and easier to solve more and more complex network issues. And all of this is obviously on crypto and blockchain, and Web3 is, of course, the underlying architecture.
So let's just touch crypto. There's the coin. How do you, and I think this is particularly important, bear in mind everything that happens in crypto nowadays. On one end, there's an explosion of the prices, and the other end, there's a lot of still regulatory stuff. So for people listening to us, I think probably there's the ones that understand a lot and the ones that don't understand anything, like you said. So how do you explain, especially related with the crypto part, and why you start? Because you are working with big governments, big institutions, and you achieve a massive breakthrough in terms of both the technology, but as well the different parts. A bit of this work between the crypto less regulated and the full regulated, highly compliance and driven institutional world.
Yeah, absolutely. I mean, healthcare and compliance are two sides of the same coin. You can not really deliver any kind of meaningful healthcare solution, platform, network, service, unless you're able to demonstrate compliance. So that's a given. And the way the crypto comes into play is about efficiency of payment. So healthcare has some unique payment issues. Commerce is easy to understand. Dennis is selling something. I want to buy that. We negotiate a price. I pay. I get the service or the product, and we're done, right? It's a A-B transaction. A sells something, B pays for that. They have agreed upon the price, and the transaction is over. That's majority of financial transactions in the world. Of course, there are more exotic transactions, but majority of transactions around the world we purchase a service, we pay for the service on a pre-agreed price. In healthcare, none of those facts are true. When you buy healthcare, you don't actually know the price. Most healthcare is sold on the basis of, first I'll deliver care, then I'll bill you for it later. So most healthcare payments are not based on price, but on an episode, and that episode keeps changing. And by the time the episode finishes, 100 variables come into play before you can determine the price of the episode. That's why healthcare payments are very complicated, because you don't start with a pre-agreed price. You start with an outcome, and then you spend tons of money to get there. Then eventually somebody has to reimburse you for all that money that was spent to achieve the outcome. And then you also get into rules. How much money can be spent before it's too much? All those things I talked about earlier. So all this is done in a very chaotic and unfair way. It's unfair to everybody, the buyer, the seller, the buyer being the patient, the seller being the doctor or the pharmacy or the lab. And then the administrator, whose very unfortunate job is then to broker some kind of a piece of code for this episode to be fairly compensated without pissing off either side. And then eventually even a fourth party pays the bill because the patient can't pay the full bill. Insurance or government or employer pays the bill. So you have this multi-party payment problem. So when it comes to financially, a lot of people say to me, I'm going to make a sidebar comment that, crypto or blockchain is really good for fintech. And I'm like, yes and no. Fintech, that as we see it today, is extremely transactional, A-B transactions. And the real problem we have as humanity is this A-B-C-D-E transaction that happens in healthcare every day, millions of times a day. And yes, healthcare in US might have an A-B-C-D-E problem, But you know what? UK at least have an ABC problem. And in most of the world, it's at least an ABC problem. Very little in healthcare is an AB payment system, very little. In the rare occasion where you go to the doctor, you get a prescription, or not even a prescription, you have him talk to you, he gives you 15-minute consult, he charges you $20, you pay him, there is no fallout, there's no more transaction. That's the minority. Majority of the transactions are way more complex than that. So we designed Solve Token to address that ABCDE payment model, and it is complex. So you need to have the ability to not just move assets between two wallets, you have to be able to link that movement of assets between wallets with a lot of event logic that says, did A do what they were supposed to do? Did B do what they were supposed to do? Did they follow the rules of the network? If they did, can C now pay the bill? So that deterministic logic of saying A performed their task, B performed their responsibilities, and now C can safely pay a price point that they have to convince A is the right amount based on rate tables and other things. This is a complex issue. So it is today done through a ton of tech and a lot of phone calls and emails and faxes and a lot of lawsuits with each other. This is a mess. And it's a mess that is costing the US hundreds of billions of dollars in just brokering this payment. It's not even about moving the money, it's about brokering this dialogue between these parties to achieve an outcome is ridiculously expensive, and it really costs US hundreds of billions. And then so does UK, by the way. It's not that different. It's slightly less complex, but still very complex. We're just talking about different shades of gray here. So in that sense, we saw a huge problem, and we saw an opportunity to use programmable money, which is what crypto really is, logic-driven money, and to be able to link payments to events and behavior and actions. And that's what Solve Token is designed to do. Now, for this token, and it has many ways it can be utilized. Solve Token can be used as a pure asset token, moving between party A to party B for a transfer of value, the way you would use any other crypto. But it can also be programmed to work against certain events on the ledger, which means its value will be set by the events between parties. It can also be used as a stable coin during the transaction period. So if I'm sending you $100 worth of Solve, you need to get $100, even if the price of Solve might change in the market. So as a doctor, you don't want to have a variation in your redemption price. So Solve is a very unique token in that it does way beyond Bitcoin or Ether can do. It is a truly configurable healthcare multi-party payment object, and it can be configured and controlled by the cards and by the network rules. That's what it does.
It's really impressive that you guys managed to keep building the token. And of course, crypto has been going through a lot of volatility, about a lot of challenges, but you have a very strong roadmap that is solving a very concrete and larger problem, but as well putting the blockchain, kudos to that. I know that is not easy, and the quantity of projects that we saw facing and disappearing. So well done on that. And I think for people listening to us, this is an example. And this is nothing commercial, but I think it's an important why, because I think the innovation, that's what matters here. And that's what it can solve a lot of problems. So in the scope of time, and I want to go right now to some big questions that I have here, because of course you are a global expert in the healthcare industry. So when we talk about the healthcare industry, we talk as well about the well-being, we talk about mental health care, we talk about a lot of different things. But at the moment, effectively, there's a lot of challenges that are facing the global healthcare industry. So there's the high turnover rates, there's worker burnout and stress, longer work hours, a lot of issues, even people not doing preventive medicine care. That sometimes it costs much more, or actually destroys part of the health in a lot of cases, and a lot of other different things. So from your experience and as well now looking at in a global scale, of course you're based in the US, but you have quite a lot of experience worldwide. And we just mentioned the UK, but there's Europe, there's even India, Africa, and so forth. So if you look probably top level, you touched a lot of different things like the data fragmentation and a lot of different things in terms of even just putting the different institutions working together. But there's other things like, for instance, the cybersecurity and a lot of different areas of competition and the invoice and payment processing, which partly is solving. We touch big data, we touch health equity, slow clinical workflows, which I think probably is one of the most challenged. So when I talk about the healthcare industry, there's the technical issues, there's the human issues, and there's the infrastructure. So as an healthcare expert and as well as an industry leader, from your personal experience, what would be like the top five, if let's talk about five, because it will make you probably think a bit more, that are the things that we could solve, or at least we touch a lot of things you can solve that you are solving, but the problems that we're facing and the challenges, probably the challenge is a bit some kind of medicine for them.
I mean, so there's many different ways you can look at it. I look at it in a very clearly defined pillars of what it means to have more effective healthcare and what we can do as tech company and as responsible citizens and as healthcare innovators. The first thing that I see is that we need to decouple this trade-off of what do I have to give up to get care? That trade-off today has become draconian, meaning how much identity, how much data, and how much control I have to give up for getting care. And right now, that is a very imbalanced picture. In the US, as an example, if you go to get care, first thing you do, you sign your life away. HIPAA, permission to use your data as they want, keep it as long as they want, mine it for whatever purpose they want, share it with whoever they want. So right away, you give up all your control on data, or the doctor won't even see you. Then you expose all your medical, clinical, financial benefit information to them to be even seen by the nurse. So there's a wrong kind of right now a agreement or a trade in place where you want care, you have to give me absolute control over your identity and your data. So I want to fix that because I think that leads to a lot of abuse and inequity in healthcare everywhere. I really shouldn't have to sacrifice my autonomy and sovereignty as a human being because my kid is sick. But that's the trade-off today. That's the bargain. The second thing is choice. We are all bound to geography. Healthcare, like politics, is local. So we are all born to say, and this used to be true for everything, where you lived and what your trade was and who you married was all local. It was, the old system of the way we all grew up for 1,000 years. But now technology has changed that. We don't have to live where our parents grew up. We don't have to study in the same schools as them. We can be friends with somebody across the world with a simple chat message. So the world has become a lot different, but healthcare hasn't changed. Healthcare is still very regional, very local. And we need to change that. So we are talking about giving access to care options that are not readily available in your local geography, but you should still have access to them within reason. Second opinion networks, remote testing networks, access to best protocols that are happening different. And I want to make this very personal because I just lived through this, if I may. I'll come to the other 3 points. Talking about access. So my mom recently, but in February, I got a call from her neighbor. I was in Asia that she fell down in her kitchen. She's almost 80 and she's pretty healthy and she travels the world. She's very active, works out in the gym every day. But I heard that she's unable to walk as a result of the fall. So I dashed back to the US. We took her to the doctor. They said she has severe spinal compression and this is going to be debilitating and probably she'll never walk again, which I refused to accept. So I started to call local doctors and I spoke to 3 big health systems here. Then I took her to here being Washington, D.C. So we have major health systems here. GW, Johns Hopkins is nearby, Kaiser is here, big names, big hospitals, big infrastructure. And we got very conflicting advice from we got to open her back up right now and rebuild her spine to I can replace her discs to we should do nothing to and so on. I used SolveCare and the care platform to access clinical research in Korea and in Germany, and I found there are better care models available. So I contacted those doctors. The bottom line here is, through this extensive many weeks of research, despite my massive Rolodex in healthcare, I was given 3 very starkly different choices by 3 different majorly powerful and reputable institutions on what to do. It was do nothing, do minimal surgery to do complete spine reconstruction. And they all argued for their care model being the best one. And through my own diligence and through the help of Care Platform, I made a choice. She went through the procedure we agreed to. We got fierce opposition from everybody that is not the path to go because they were focused on what's usual and customary. And I was focused on what's good for my mom, not what's usual and customary. And we made the choice, which only 1 out of 30 doctors was willing to perform that procedure. We got that procedure done. She's out of bed in a week and she's walking with a walker, and we have defied all the odds. to say she will never walk again, and she's going to probably be able to travel internationally in the coming year if she keeps recovering. How many people can do that? I had trouble doing that. And I had full access of the care platform and my old Rolodex and my access to people at the highest echelons of healthcare around the world, not just US. I contacted doctors in Korea. I contacted doctors in India. I talked to doctors in Germany who I happen to have in our ecosystem. You don't have that access. You should. So we do need to fix this. And we are far from fixing this the way it should work, but we're making great strides to do that. So that's what I mean when I say access. We should not be bound to the doctors are fallible human beings. Their training and their revenue models and their experience is bound to certain parameters, and those parameters don't always work for you, and they shouldn't. So we have institutional care, we need personalized care. And that's where I believe Care Platform is really moving us towards. The third part is ability to affordability of care. What if I can't afford the doctor surgery here? Can I afford that in Panama or can I afford that in India? Can I compare prices? What about the cost of flying there? How will I do recovery? And I did that analysis, and I came to realize that while economically it would have been easier for me to fly her to, let's say, India or Germany and get her treated there, despite being, in a hospital for 3 months, the choices that I made were more around her comfort and the less risk for her. But sometimes economy is going to trump your choices. So we should give people all those options. They're typically removed from the table. They're not even there. So access and choice of access is a really big deal. The fourth is ability to compare your care to best practices. How do I know that I got her? Is she being treated well? Is she following the protocol that is the best protocol for her? So having this ability to measure quality and outcome of care as a human being who is not a clinician. I may sound like a doctor. I'm not a medically trained doctor, but I've been in healthcare long enough to know how to speak with them, but I can't speak for them. But I have enough knowledge to understand what they're saying and compare the various opinions and arguments. But, clinical quality is a big issue. It needs to be measured, right? So that's the fourth pillar. And the last pillar always is compliance. If I'm going to go out of compliance by choice, it should be with my consent. If you're going to give me, if you're going to choose path A or path B for my mother, you should inform me of both A and B and let me choose. But consent should drive care. And today, a lot of the care is not driven by consent. In fact, hardly any care is driven by consent. And that's a bad thing. We have all this regulation around healthcare that is supposedly there to protect you and I and our parents and our children. But that consent model has been so deformed to where that's now the Faustian bargain, where you have to give blanket consent for everything to get any care. Instead of having really relevance of consent, we are basically now making this consent a blanket requirement. Otherwise, you don't get any care. So that's the wrong model. It's a Faustian bargain. We HIPAA, for example, or HITECH, or even Obamacare, the ACA, we were all supposed to restore patient rights. Come on, guys. We restored zero patient rights. I was there. I spent billions of public health dollars to implement the systems that actually disabuse patient of any control. So let's not kid ourselves. Patient is not in control of anything, neither data nor consent. And I think that really triggers me, because we as human beings should be served by the healthcare system, not the other way around. And I think the consent model is completely upside down. So those are the 5 things that drive my North Star, my compass. If we are making a positive impact on any of these 5, I know we are headed in the right direction. If we are doing things that don't really drive any of these 5 pillars, then we are wasting our time. This is how I prioritize product investment and R&D.
And I couldn't subscribe more. I have the same case, and I'm sure everyone listening to us has the same challenge. If you don't fight, and it's a fight, actually, the healthcare should not be a fight. It's a lot of fight. So I know for the scope of time, I want to be respectful of your time. I have a lot of more questions, but let's look at the one last question, and probably is a far-fetched question, and there's a lot of dimensions, but I think I have to ask it. We touched this in the last talk, but I would like to do. So we talked about all the challenges, okay? And recently I interviewed Nick Bostrom, and of course, Nick Bostrom is one of the biggest AI minds in the world. And it's challenging when you go in terms of the looking at the challenges that are coming out of technology. And one of the things that was said, actually, this is Max Tegmark quote, is that at the moment, with especially as AI evolves, and especially AI agents, we're starting to build a new species that is digital sentient. Digital sentient is Nick Bostrom, and Max Tegmark, the MIT professor, he said, and the author, he said as well that we have kind of right now two kind of species. There's the human sapiens, and we are building some kind of a digital kind of ultra sentient species. So, of course, this is on the wrong side, and I don't want to complicate the question. But the question is, we have all these capacities in terms of AI. Most of the studies and researchers say that we will be able to solve a lot of issues with cancer and some of the biggest health issues that we have in the world with AI technology. And there's already a lot of developments and innovation. I'm sure your company is working on that as well. Of course, we talk about all the present challenges and possibilities, but how do you see this part of the AI in one way as a possible solver of all these issues around human healthcare and the human well-being, but as well as a potential kind of new evolutionary part of humanity? I know that is a big question, but I had to ask as the last one.
No, it's a very fair question given where we are living, this time of stupendous and sometimes scary change. And typically when technology comes around, we have a class of people who feel that they have this technology well under control and they'll be able to harness that for the benefit of humanity. And there are some scary technologies. Nuclear, tech is that kind of a tech. You hope that experts know how to control it and manage it and deploy it, but otherwise it could destroy humanity. AI is scary in that it's not clear if people who are building the tech and are talking about commercializing this tech know how to control it. And that's the really scary part. But that's a different conversation. AI as it is, we are mostly familiar with it through ChatGPT. Before that, we knew of natural language learn NLP and machine learning. But really, how human beings think of AI is this, generative AI, the large language model AI. Now, that large language model is, by definition, large language. It's trained on everything under the sun, all publicly available data. Even if it was I wrote that blog or you wrote the blog, is trained on everything, kind of like Google can search everything. So there, it's a more foundational technology. And, there, I don't think it's that relevant to healthcare because I wouldn't go to ChatGPT and ask for diagnosis or even care instructions or best care protocol. It's going to basically regurgitate what I can find on Google in a more organized way. So the next stage of application of LLM is to use, a more trained models, which are specifically trained on a domain like healthcare or, stock market or crypto, whatever, or on education. But you need trained models, and all this money that's flowing in Silicon Valley into AI is around training domain-specific models by and large. Right? So they're pouring billions into this. Let's build a legal LLM. Let's build a medical LLM. What are we really doing? We're training this large language model to think more specifically around a domain. So that's the next step. It's clear that's going to happen. It's right in front of us. Whether it takes 6 months or 3 years, it's going to happen. And that's going to consume very specifically the domain-specific knowledge, such as the medical dictionaries, the ICD-9, ICD-10 codes and descriptions, and all these things that are going to be domain-specific. And because healthcare is very regional, you're going to end up with regional domain models. Because the way UK looks at disease conditions is slightly different than how US looks at them. So we're going to end up with regionalized domain models for healthcare. That's clear. But so what? It's more useful than ChatGPT. And now it's trained clinically to basically sound like a primary care doctor. But the real value of AI, in my mind, and this is just my personal opinion, is if that LLM model for healthcare, that trained domain-specific model, can interact with my data, specifically current and historical data that I have, and give me specific advice to my risks. So that's personalized AI. And to me, the real useful part of AI applied to healthcare is when you migrate from general large language models to a very effective domain models, which I can trust, but they've been trained by clinicians, to personalized application of healthcare where I don't have to send my medical records to ChatGPT on the web, but rather ChatGPT runs on my phone and reads my data and gives me localized advice without sharing the data with somebody else. And that's the key. So I'm a big advocate of, because otherwise patient security, patient rights are going to evaporate. We're going to have institutional preferences drive health outcomes, and healthcare is very personal. I don't really care about what the statistical outcome of a spine surgery is. I want the right surgery for my mom, which happened to be the 0.01% of the procedure that was the right for her. So don't give me statistics when it comes to healthcare. Give me personalized care, which is what every human being wants and deserves. So AI has to follow that same model. And I believe companies like SolveCare and many others, but our vision is clear. We are going to bring AI to the patient in the context of their data, in their control, relevant to their risk conditions, only accessible to the patient. So I'm all for that the third stage of AI, and we are plotting our way to get there in a way that respects the patient and puts the patient first. So that's where we are. But there's a lot of steps between now and then. How do we, there's in AI, you have these things called hyperparameters, you have things called RAGs, and these are all very important as to who's controlling and setting these parameters, because clinical, and training of AI model is going to have a lot of built-in specialty bias. So for example, how you treat diabetes in India is going to be slightly different than how you treat diabetes in the US. And that bias is going to get built into the model. So we will need to be very careful about whose model are we using. This 3 diabetic models are not going to be the same. So we will need ranking and rating and evaluation. So we think about all that. But ultimately, even if we build and agree to a good diabetic model for each region, how do I apply it to the human whose health we are interested in? That's the last and final step. And that's when AI becomes, I think, in my mind, relevant to healthcare and humanity.
Oh, it's a great way to finish. And of course, there's a lot of more questions, and this touches a lot of things. It's been a fantastic journey. I think for everyone listening, I think there's a lot of learning to synthesize around blockchain technology in healthcare. How, as well, a company like Solve.Care created a lot of solutions around this, and in terms of strategy, it's actually a fantastic overview about all the problems and all the issues facing the healthcare industry, but as well all the solutions that can come out of that. So Pratik, I want to thank you for your time, and as well your capacity of synthetic and approach towards these complex subjects, but as well for the work you're doing. And I hope that people listening to us can actually learn and use the platform, because actually I'm learning a lot of things here. I think, as a note, I have, like you mentioned about your mother, I faced the same with my parents. I saved the same even my own health. I remember going to an hospital and seeing the first department of one top hospitals in London, the department A computer didn't speak to the department B. So these challenges are there, and I'm not even too much complicated, not even with AI. So thank you so much. Congratulations to all the work of Solve.Care. And for people listening to us, please take your care or your healthcare in your hands and use tools and learn with professionals like Pradeep. Thank you so much, Pradeep.
Thank you, Dennis. It's been a pleasure. And I really appreciate the opportunity to come and talk to you and your audience.
Thank you.